Yes, my name is Shalini Chhabra. I'm an internist and a Board Certified Geriatrician. Geriatrics is diagnosing illnesses and problems of 65-year people and older. Now, that does not mean 65 is a cutoff. There are many 65-year-old who are running on 55. And then there are many 55 who may be at 65. So 65 is just a number, but there are many illnesses basically which are age related, which come on as we grow older. And this specialty deals basically with those kind of illnesses that we see as they grow older. Commonly seen problems are incontinence issues, dementia, falls, blood pressure, high blood pressure, diabetes. So dementia is not normal aging. A lot of people think that, oh, I'm forgetting things, and that's a part of aging. Dementia is very different from regular aging. You can think of dementia as, you can say, I forgot my keys, I keep forgetting my keys all the time. But along with normal forgetfulness, there is also some cognitive decline or functional decline. So they cannot do their regular activities. They cannot, for example, they get lost when they're driving. So that is not normal aging. So dementia is a little more than just forgetting things, a significant cognitive decline along with forgetting things. In America, there are 5.5 million people who are affected by dementia. And this does not include the family members and the caregivers of the people who are actually taking care of their loved ones. It's a progressive illness and gets worse and takes a toll even on the family members. Initially, they begin with forgetfulness. Initially, they begin with, I cannot remember this and I cannot remember them. And later on, it progresses to the point that they start forgetting things which are important in their lives, forgetting their appointments, forgetting to do their regular activities. For example, they would go every day to do some shopping, or they would do every day to the gym, which they start forgetting. As it progresses, they can even not remember who and how they're related to their loved ones, which is very painful for their family members. It's kind of interesting and sad to see that you can even see people who have been married for 50 years. With the onset of dementia, they will not even remember their spouses of 50 years of marriage. It takes a toll on their husbands or their wives to see that their wife or their husband cannot even remember them. And they've been married for 50 plus years. They come to a point where they're almost like they have a shell around themselves. It's almost like a cocoon, and they start getting restrained or refrained because they cannot remember the people around them. Currently, there is no good treatment to totally take care of it. But there are options. There are medications which slow down the progression of the disease. This helps people stay more functional at home with their family members. It can even delay, some people don't want to go to the nursing home. They want to stay at home, and it can allow them to stay at home till as late as possible. So these medications slow down the progression. And then there are some factors which we can work on, helpful factors to control the progression of dementia. Things like controlling blood pressure, things like cognitive training. So if we start noticing that someone is becoming very forgetful, we start doing cognitive exercises, games, that they recall, these kind of things. Even physical activity helps a lot, to do as much exercise as they can physically do and safely do. That improves the blood circulation, not just to the heart, but also to the brain. And we do see that could have, or that may help with the dementia progression. The best thing would be to get diagnosed as early as possible, so that we can start the management as early as possible, so we can slow down the progress in the early stages. See your provider, see a geriatrician who can explain to you what to expect in the near future, and to try to understand this illness, not only for their caregiver but for themselves, because a lot of it will fall on them to ultimately understand their illness and take care of them. I have seen dementia growing up, and I know how hard it is, not even only for the patient but for the caregivers. Every time I see someone who is coming to my office, for me that person is not a patient. For me that person is a person who has family members who care for him or her, and I treat them as if I would treat my grandmother or my grandfather or my parent if need be. I want to make sure that they understand and they are involved in their care, and I am very much involved in their care.